I'm Carol Mitchell. I'm a locality manager with Skills for Care in the North West team, and I work in Greater Manchester. And why is wellbeing so important for the workforce? We need to really support people to be able to be at their best. They've worked incredibly hard. There were already pressures in the health and care system prior to COVID, but the last 2 years have really added an extra layer of complexity, and people have been under tremendous pressures. They've had changes to the way they work, changes in their home circumstances and things like that. So it's really important that we look after our people. They're our greatest asset. The thing I'm really impressed with about how the impact for social care workers from the GM wellbeing work is that this has been primarily developed with public sector colleagues, and they have opened this right from the start to social care workers as well. So all of the support that is available in Greater Manchester has been opened to social care workers, whatever they do, not just frontline care staff, but everyone working in the sector. So health and social care people can get the support they need, and the diverse range of the support on offer is amazing, really. It's been a really good piece of work to support the wellbeing of our workforce. A better wellbeing approach in Greater Manchester, I think the approach that is there is very good, it's very diverse, there's lots of stuff on offer. What would be good for me would be to see more of our people taking up that offer of support. The Wellbeing Toolkit in particular actually is a really useful tool, not just for managers for themselves, but for supporting their teams as well. They can look for personally, they can look for support, or they can look at how to support their teams. Whilst all this is available, we know that the health and social care workforce are amongst the last people to look for support for themselves. People have to put themselves first, and they're not used to doing that. They're used to putting the people they support first, but they have to look after themselves and their families so that they can continue to do the best for others. The health and social care workforce, there is evidence to show that people who care for others are less likely to look for care for themselves. And we need them to look after themselves, look after their own well-being, be that physical or mental health. We need them to take care because you cannot drink from an empty cup. So if they were to look after themselves, put themselves first, so that they continue to do the brilliant job they do, providing care and support to others, that would look brilliant to me.